All right. Very warm welcome to this Q3 interview with the CEO of OssDsign, Morten Henneveld. My name is Elvin Rolder. I work as a research analyst here at DNB Carnegie, and we'll be moderating this interview with Morten. Before we dig into the Q3 report, warm welcome, Morten.
Thank you very much.
You've been with OssDsign for 5 years now, and this was your last quarterly report.
Yeah.
How does it feel to have it published, and how would you summarize these 5 years at the company?
Well, of course, it's a very strange feeling. It's been such a big part of my life for 5 years. Listen, I'm incredibly proud of what we've achieved, right? We've taken the company from an EU-centric, patient-specific cranial implant company that had been struggling for many years into a very high-growth, US-focused orthobiologics company. We've multiplied revenue. We've lifted gross margin from around 40% to, we just reported 95.6%. And it's been a tremendous turnaround in every sense of the word, to the point where the only thing that's actually left, which is a little bit mind-blowing to think of, is the name OssDsign and very few employees. Otherwise, everything is new, everything is changed. So people may think of OssDsign as a company that was founded at 11, but as we know it today, it's actually only about 3-4 years old. So no, it's been a tremendous journey. We've created a lot of shareholder value. We've brought in a lot of big Swedish and international institutional investors, and the company has really come a long way in a very short amount of time. So no, I'm proud of it, and I think I can hand over to a new CEO with pride.
Yeah, I concur. And if we dig into the last report, then Q3 numbers, you had 35% organic growth year over year. You grew 5% quarter over quarter on an underlying basis, and cost control remained solid. How would you summarize the report? Was it, in your own words?
No, I think it's a very, very decent report. As we've said multiple times for the last many quarters, we're going to have some quarters where we jump more, and we're going to have some quarters that are more flat. We jumped a lot in Q2 and Q3 as a result of that, and also the change order pattern that we reported already in Q2 impacted on that. But no, I think we're seeing a strong underlying momentum. We see our approvals in the US keep following the same trend. We see more users. We see more usage per account. We continue to operate with a very high gross margin, and we reported the best quarterly EBIT in the history of the company. And then I think it's worth noting that the quarter started very slow. We saw an impact we believe is seasonality, and then September was the strongest month we've ever recorded, and we see that continuing into October. So we continue to see the very strong momentum in the company that we've seen before.
About the momentum, you mentioned that you're getting more approvals and more access. Has there been any change in? It's quite early days since Propel was published, obviously. But have you seen any kind of change in how your customers or surgeons approach OssDsign and your product Catalyst, or in general how they kind of choose catalysts for their procedures? Has there been any impact so far? Is it too early to kind of?
I think it's a little bit too early because the approvals that and we continue to get more approvals also during the quarter. A lot of them were submitted before we published Propel, so I think it's a little bit premature. What we have seen is this is our first large study. It's 108 patients. It is absolutely outstanding result, 88.4% fusion in a real world, very challenging cohort. You don't really see that anywhere else. So I think it has boosted our body of clinical evidence, and it certainly also means that we are now in dialogue with surgeons that we weren't in dialogue with before, because this resonates incredibly well. It's created a lot of positive noise in the market that we can show these type of fusion rates.
Yeah, and the general feedback from surgeons, because I understand that maybe a couple of years ago the market overall was maybe more focused towards large clinical trials or randomized controlled trials, and this is obviously real world data. How has the feedback from the surgeons been so far?
Yeah. No, but I think it feeds well into that. I mean, for many, many years, and still is to some extent, there's an obsession, of course, with doing randomized controlled trial because they have a value, you isolate the variables. But it's also become an increasingly accepted challenge that no one can replicate in a real-world population the results that they're seeing in the randomized controlled trials. So there is a shift among surgeons, but certainly also for the FDA to increasingly acknowledge real-world data. And I think when we can demonstrate that, what essentially we are showing is surgeons tend to use other products sometimes if they have challenging patients, something called growth factors, BNP2 products, and things like that, which are both risky products. They're liquid, they can run. And they're also very expensive. So if we can demonstrate these type of fusion rates with OssDsign Catalyst alone, then it does raise the question, and that's the feedback we get. Maybe I don't need to use these other expensive and somewhat dangerous products. So that's kind of the feedback we are getting, and that's exactly where we want to be. Because of course, if you can solve the challenges for the difficult patients, then you can also solve these simple patients.
And you mentioned during your quarterly webcast here that you've been actually increasing your average selling prices for Catalyst. Has that been a more of a result of that you're becoming quite bigger and then you're able to maybe have a bit more high pricing power than compared to when you first launched or the first couple of quarters? Or have you been able to leverage the Propel data in order to command a higher premium on the prices, or would you say it's just
well, I think, when we talk about ASPs, right, that's of course across, hundreds of customers now. So Propel in itself mathematically won't be able to change that. But of course it is a result, when you start, you have no clinical evidence. We didn't have that for the first many years. There's always a safety concern, which there rightly should be so from surgeons. But, we've treated more than 10,000 patients. We have 16 publications right now. We have Propel. And of course, all of that means that we come in with much stronger cards on our hands. So then when we are negotiating with hospitals and surgeons really want to use the product, of course, we are in a better position to demand a higher tier pricing than what we otherwise probably would have been able to get.
Great. And earlier this year, you announced your new strategy, Scale to Profit. Could you perhaps just begin on in general what that strategy entails, and then we can dig into some of that?
Absolutely. I mean, Scale to Profit is what the name entails, right? It is a growth strategy. And it is a strategy that will bring the company to profitability and cash flow positive in the second half of the strategy period that runs until 28. I mean, the key thing is that it's a growth strategy. So if there are people today who felt maybe we should have grown a little bit more and so on, well, that's exactly what we're working on. We're going to double the sales force. We had 10 as we came out of the second quarter this year. We want to get to 15 this year, and we want to get to 20 in the next 3-4 months or so into 26. That is, of course, a material change. That's going to fundamentally change the growth trajectory of the company when you have twice as many people actually selling your product. So that's a very important component of that. Then we only have one product today. We're going to launch 2 new products. The next one is going to come already next year. So that's also going to boost growth. Then we're going to start a level 1 randomized controlled trial. That's going to take a while. We're looking at starting it, we think, in the second half of next year. That's going to take some years, but what it ultimately will do is that it's going to put us into a very select group of orthobiologics companies that can demonstrate level 1 data. And then, of course, we will keep building the Propel data, knowing how strong it is. And then last but certainly not least, we want to be able to scale production. And we also want to have it more cost efficient. So even though we are operating at this 96% gross margin right now, we actually have line of sight to reducing costs even further and thereby improving that gross margin in the years to come. So I think the company has a very, very prosperous future. The momentum we are coming in with right now, combined with the investments we are making right now, I have no doubt will take the company to a very different level.
And perhaps staying a bit on the strategy and the randomized control trial. It's of course a few years out, but what do you kind of hope to achieve with that data in hand compared to what you have right now, and maybe future publications as well from Propel? Yeah. Do you think it's kind of a segment within the market that you can't approach right now that you will be able to tap by then, or in general, what would you expect from the data?
Well, I think it's going to serve a number of purposes. I mean, we are going to continue building Propel, in particular, knowing and seeing how strong that data is. We want to continue to publish on that. But of course, you can always be met with the objection that this is real world data. You don't have a level 1, which some of our competitors already have now, and some will have. So I think it's important when you create a strategy for a company, you need to see what is you're going to compete against in the years to come, not just tomorrow, but also in the coming years. And that's where we see that if we want to be in that group where we're not going to have that objection while you don't have level 1 data, then that's exactly what we need to build. And yes, it will give us access to centers that otherwise maybe are insisting that they only want to work with products that have level 1 centers.
Great. Regarding the strategy, what would you say is the kind of the biggest hurdle or the biggest challenge with it? Yeah. If all stars aligned, everything goes perfectly well, but that's not usually, at least, what happened in the real world. What would you say is the biggest kind of sensitivities within the strategy? And
I think, I've seen many strategies over the years where there was a lot of sales baked into the new products. And that's always, to me, a little bit of a risky strategy. That's not the case for us, actually. By far the biggest element into the growth is the doubling of the sales force. We have a very strong trajectory. We have a good name in the market. We have a very strong product. So, of course, that helps us in our ability to sell. But, it's not only we need a sales team of 20 people, we also need 20 high-performing salespeople. So, of course, quite naturally, we also have to replace all the time. So, it's a lot of recruitment. We're still a small company, and we also need to find the right people to come in. So that, to me, is the most important thing that we need to solve, but also one that we need to solve within the foreseeable future.
And of course, still early, but how has that development been going so far with the recruitment of salespeople? Are you stealing them from competitors, or are you finding them elsewhere? Or?
Yeah, well, it's going to be a mix. We are benefiting a little bit from some of the noise in the market, some of the partnerships some of our competitors have made, and a few other things. So it's going to plan. I mean, we hope to have 5 additional people by year end, as I said, and another 5 as soon as we possibly can into the new year, knowing that it takes some time for salespeople to kind of build up the volume. So no, things are going exactly to plan, and that's also why, I mean, clearly when we have these people on board, you should be expecting, us coming back up to higher growth rates than maybe what we reported here in the quarter.
Great. I think actually that was all questions from me, Morten. Are there any final remarks you would like to say to the audience, given that it's your last quarterly report here with
No, well, I have many things to say. No, I just want to say a genuine thank you for the last many years. It's been quite a ride. And we've been blessed with a lot of support from investors and partners and other people. So I just want to say a genuine thank you for supporting us on that journey. And now it's time to take the company to the next level. And that's why we're finding a new CEO with a lot more presence in the US. So thank you very much for everything. It's many years, 5 years. So thank you.
It's a long time. Sounds good. Thank you everyone for listening in, and thank you as well, Morten, for these years of collaboration. I think it's clear to everyone what you have done with the company, and everything sounds very promising about the future. So we're looking forward to see what happens with OssDsign without you, so to say. But yeah, cool.
Good. Thank you very much.
Thank you.
Thank you.